Hey guys, Dr. Liz here. I'm a psychiatric nurse practitioner with a doctorate's degree, and I am coming at you with informational tidbits on psychiatric care for your family and you. So today we are talking about the medication Clonidine. What is Clonidine? So in internal medicine, we use Clonidine to treat high blood pressure, but we do not treat blood pressure in psychiatry. So we use Clonidine to treat ADHD in children. Clonidine can also be used off-label to treat tics, insomnia, and opioid withdrawal. Clonidine can be used alone or in conjunction with stimulants to treat ADHD. However, it's not super great at treating the inattention or the focus part of ADHD. So stimulants are the gold standard, or like the best medicine for ADHD, because they treat all three components: impulsivity, hyperactivity, and inattention. Clonidine is a good alternative or a good supplemental medication, but it only really helps with the hyperactivity and the impulsivity of ADHD. It's not super great for the focus part. Okay. Another downside to Clonidine is, unlike stimulant medication, it does need to be taken every single day, and it takes longer to kick in. So stimulants usually start working either the same day or the next day, and Clonidine usually takes about 2 to 4 weeks to kick in. So a little bit longer, but again, still good. It just takes time to kick in. Other downsides to Clonidine include side effects, which all medications have side effects. So Clonidine has a few side effects as well. Fortunately, they're very rare. Things like dizziness, headaches, constipation, and something that we actually really like, which is sedation or sleepiness. And the sleepiness is actually a pretty common side effect, but we like it because kids with ADHD tend to have a really hard time sleeping at night. Their brains are restless, their bodies are restless, and so they have a hard time falling asleep, and they have a hard time staying asleep. They tend to pop awake at nighttime. So the next morning they wake up and they're grumpy because they did not get good rest. That makes their behaviors worse. It agitates their ADHD. It makes it harder for them to sleep the next night, and the cycle repeats and gets worse and worse and worse. So Clonidine comes along and is able to break that cycle and helps our kids to get good sleep. We like that. The other thing we like about Clonidine is it's non-addictive. There's no withdrawals with it, although we do need to be mindful of something called rebound hypertension. So that means that if you are taking Clonidine consistently, which you should be because it's meant to be taken every day, we do not just stop the Clonidine. If we abruptly or cold turkey stop the medicine, our blood pressure can shoot up a little bit too high, and that can be dangerous. So rebound hypertension is very easy to avoid. If we want to stop Clonidine, we don't cold turkey stop. We call our psych doctor and they will help to wean us off. They just have to break the dose down little by little, and it usually only takes about a week to 2 weeks, and then the child is safely off the medication and we never had to worry about rebound hypertension. So in summary, Clonidine is an awesome medication. It's a really good alternative medication to stimulants, or something that can be used in conjunction with stimulants to help a child sleep at night. Again, it's more so to help with hyperactivity, impulsivity, or again with sleep, not so much to help with the focus part of ADHD. It's non-addictive. We don't get withdrawals from it. It does have to be taken daily, and we do have to watch out and be mindful of rebound hypertension. And then the best part of Clonidine, again, just to reiterate, it helps the kids sleep. Like, that's huge. So that's it for Clonidine. Watch out for my next medication video. And thank you guys so much for watching. We'll see you next week.